So welcome and congratulations to our admitted students and their families who are joining us today, wherever you are, whether it's here in the US or abroad internationally. We are very thankful for you to be here and want to extend a warm congratulations again on your admission to Rochester. My name is Brett Cameron. I'm the Assistant Director for International Admissions here at Rochester, and just here in a supporting capacity for this session. So just to share a couple of quick tips about this session, we will not be using the chat feature today. So we will primarily be using the Q&A for after our colleagues here and the on-campus support services do their presentations. They'll be taking questions from the Q&A box. So you can find that at the bottom of your screen, your Zoom box here. And an important tidbit about this Q&A box is it will allow you to actually upvote questions. So if somebody is asking a question that you also have, it is really cool that you can actually just thumbs up it. And then that will elevate that question. We can see where the most interest is for those questions being asked today. So don't be shy. There's no such thing as a dumb question. So please do share those. And without further ado, I will go ahead and kick it off to my colleagues here today. Thank you so much.
Congrats, everyone. It's really great being able to chat with all of you today about all of the resources available to support your wellness while you're on campus. So today, as I just mentioned and Brett mentioned, we'll be talking about health and well-being at the University of Rochester. So there's going to be folks like myself from the University Health Service. We have primary care, the University Counseling Center, as well as the Health Promotion Office. And we also have colleagues from the CARE Network, our Title IX office, as well as our Department of Public Safety. And so before we go into introducing ourselves, we just want to provide a land acknowledgement and just to have a shared space of acknowledgement of the land that we reside on. So the University of Rochester is located on the ancestral and unceded territory of the Onondaga or the people of the Great Hill. In English, they're known as the Seneca people. And so the Onondaga people are members of the Haudenosaunee Confederacy, which consists of the Mohawk, Oneida, Onondaga, Cayuga, Seneca, and Tuscarora nations. And so we honor and pay our respects to elders, both past and present, who have stewarded this land through the generations and whose practices and spiritualities are tied to this land. Please take a moment to consider the many legacies of violence, displacement, migration, and genocide that have occurred on this land or the land where you reside. And so we'll all just be providing some introductions for our session today, and then just some key information from all of our offices of things that would be really helpful for you during your 4 years at the university.
The senior insurance advisor. I'm on Eugene's Zoom because I can't get mine to work and show my picture. So I came over to her office. I've been at the University Health Service for about 11 years, and I coordinate the university semi-annual open enrollment hard waiver insurance selection period activities. I also coordinate insurance enrollment due to qualifying life events or early termination request. And I represent URship and serve as a student insurance advisor to students, parents, and members of the university community regarding eligibility guidelines and plan coverage for university-sponsored health insurance plans. I like spending time with my daughter and volunteering with her Girl Scout troop and taking our dog on adventures.
Hi, I'm Yunji. I'm Health History Form and Immunization Advisor. I coordinate the assignment and collection of health history form, verifies immunization records, provides vaccination info. I also assist with UHS Connect account registration. So if you or your kids have questions regarding UHS Connect, you can always reach out to me. I enjoy ice skating and food in my leisure time.
Everybody, I'm Mike Sember, and I'm curious why I have two boxes in the panelist view here. It seems to be a mystery for me. I don't know where that is, but yeah, I'm Mike Semper. You see him pronouns. I'm the Assistant Director for Group and Outreach at UCC. I oversee our group and outreach programs. I also provide clinical services, therapy, supervision, crisis services, which I'll get into later. And I have 2 kids I love spending time with, and I also enjoy playing clarinet.
Hello, everyone. My name is Rebecca Block. My pronouns are she, her. I am the health promotion specialist for student well-being at our health promotion office, and I also direct a large initiative called the Mindful University Project here at the university. I'm a yoga and mindfulness teacher. I oversee health promotion strategies, a lot of our programming, supporting students' well-being, not only undergraduate students, but also graduate students, with a primary emphasis on student mental well-being and flourishing. And so I'm really passionate about creating a compassionate campus culture through trainings to support faculty and staff and student leaders that help equip them with tools to support the well-being of students. And so outside of work, I love hiking, baking, practicing yoga and meditation, and reading. And I also am a U of R alum. I graduated in 2018.
Hi, my name is Zoe Black. I use she, her pronouns. I'm the Health Promotion Specialist for Health Equity in the UHS Health Promotion Office, and I'm a certified LGBTQ Safe Zone trainer as well. And I oversee all of our sexual health and health equity initiatives for students, as well as our undergraduate student employees. And I'm really passionate about making programs and materials accessible for all, as well as LGBTQ plus advocacy. And I love traveling, spending time with family and friends, and doing anything with my dog. And I am also a U of R alum, class of 2020.
Hello, everyone. My name is Alex Samores. I'm the director of our Care Network on campus. So the Care Network is our primary hub on campus to get resources, connection, and support. Our aim really is to identify students who may be struggling with any concern on campus, meet with them and work with them to get them to the right resource and support. As you can see, even from our small group, there are lots of different ways to get help on campus, and sometimes that in and of itself can be challenging to navigate, and that's where our office can also play a role. We're referral based, so I'll share more about how you can get in touch with us later, but I also coordinate our care network across the undergraduate as well as graduate offices as well.
Hi, everyone. My name is T Street. My pronouns are they, them. I'm the Associate Director for Sexual Misconduct Prevention, Education, and Response in our Title IX office at the institution. My primary role here is I educate all of the students. So most of the students that will be attending here will have some required mandatory training that I help oversee and launch via Blackboard orientation, and additionally some online training and then training throughout the year. As my background shows, April Sexual Assault Awareness Month, so our office does a lot of prevention programming throughout some interest months. Additionally, I also meet with students if they need to learn about their needs regarding a university grievance process for either a Title IX process and or our student sexual misconduct policies. Again, we talk about resources, supportive measures, and reporting and resolution options that are available through legal rights through that process. I'm pretty boring. I unfortunately have been here for probably a long period of time out of our group here. So I've been here for 12 years. And I spent some time in the Department of Public Safety, so I have a wealth of knowledge about the institution and the background here, and I will turn it over to my next colleague.
Thanks, Dee. Everyone, my name is Josh McCartan. I'm a lieutenant with Public Safety. My primary scope is community engagement, so I'm out there in the university community, both on campus, in the medical center community, providing education and presenting on various topics. Another facet of mine is the threat assessment role in interacting with victims of particularly violent crimes and providing them resources when necessary, and also play a integral role in when the university itself is receiving threats. So I'd be happy to talk about that later on in our presentation.
So now we'll have our colleagues from primary care talk to us. Joyce?
Yeah, are you gonna do the slides or?
The primary care is you and Young Jang.
Right, but I don't have them to look at them, to read them.
They're showed on the slide, the Zoom.
I mean,
Yeah,
it's-
I can do it. I can do it. Yeah.
okay,
So, yeah, University Health Service, we have primary care. We located on the first floor of the UHS service building. We open weekdays all year. We also have after hours emergency on-call availability. You can run down this number, save it to your phone. It's 585-275-2662 if you need any healthcare service. So you can always find us in 3 convenient locations. We have Eastman campus office, River campus office, medical center office. For the Eastman campus, we are within a student living center on the first floor, room 106. For the River campus, UHS building is on the first floor. The address is 738 Library Road, Rogers, New York. For the medical center, it is currently closed for renovations. Anything that will be updated should post on our website. So feel free to check back. So for UHS mission statement, the mission of University Health Service is to improve guard and care for the health and safety of University of Rochester students and staff. As part of an academic institution, University Health Service also participates in the education and research missions of the university. The providers and staff at UHS value caring for the health and well-being of our patients, respect for the diverse individuals we serve and with whom we work, and excellence in all that we do.
Eugene, I can take over, I'm sorry.
Yeah,
All
thanks.
right, UHS primary care. As a full-time student, you will receive your primary care services right here at UHS. You will be assigned your own primary care provider who will coordinate your medical needs and provide continuity of care during your time here in Rochester. Our services are always confidential, and it is important to know that you will have 24/7 access to one of our on-call physicians. All full-time students are covered by the mandatory health fee. This fee covers a full range of primary care services provided by our highly qualified providers. Covered services include evaluation and management of acute injury or illness, ongoing medical conditions, women's health care, gender-affirming healthcare, allergy injections, immunization administration, and the coordination of care for any health concern. Visits with UHS psychiatrists for assessment and medication management. That does require a referral from a UHS primary care provider or a UCC therapist. Additional services and programming are offered by UHS Health Promotion Office and University Counseling Center, which will be discussed a little bit later in the presentation. I will talk about health insurance. Every full-time student is required to have health insurance in addition to the mandatory health fee. Health insurance provides additional coverage for services not covered by the mandatory health fee, such as specialist appointments, hospitalizations, surgeries, diagnostic laboratory testing, imaging, and prescriptions. Students can either enroll in the UR health insurance plan or waive if their insurance plan meets our university criteria. All full-time students must complete the online health insurance process every year. Failure to complete the online health insurance process by September 15th or January 31st for spring entering students will result in automatic enrollment in the student health insurance plan, and students will be charged accordingly. UHS has health insurance advisors available to all full-time students, Monday through Friday, 8 to 5. Please reach out with any health insurance questions or concerns. The UR Student Health Insurance Plan, otherwise known as SHIP, the University of Rochester offers a customized health insurance plan to all full-time students. The plan is specifically designed to meet the health insurance needs of students. Some of the benefits of using the UR SHIP, we offer a global network, preventative healthcare services, there's no deductibles, there's low copays, comprehensive coverage, and insurance advisors on UHS staff to help with questions. Services covered under the UR-SHIP: laboratory tests, x-rays, surgeries, visits to specialists, hospitalizations, prescription medication, and immunizations. Some services may require prior authorization, referrals, and cost member sharing. Options for additional coverage. We do offer Aetna Vision Preferred. Some of the benefits of that coverage is it covers eye exams, glasses, contact lenses, has a nationwide provider network, online shopping options, online provider locator, choice of popular brand name frames, Aetna Vision Preferred mobile app with a collection of helpful tools. And we also offer Aetna Dental PPO. You could choose from more than 120,000 dental providers nationwide, including providers who offer virtual visits through teledentistry. You can search for providers and network by using our provider search tool, digital tools to easily manage your care and access your ID card whenever needed. Oh, Eugene, you might be muted.
Health history forms and immunizations. Every new student must submit the health history form and allergy medication form. Forms will be completed electronically via UHS Connect. Please watch your UR email for further information regarding registration for UHS Connect and form completion. There are specific immunizations that are required by New York State and the University of Rochester for full-time students. All immunizations must be submitted with official documentation to provide proof of vaccination. Students can receive any missing immunizations at UHS if they are not able to receive them before arriving in Rochester. Other services offered at UHS. We offer nutrition therapy, physical therapy, psychiatric care, laboratory testing, allergy injection, sexual health, travel care, immunizations, medications, and inclusive healthcare, and so much more. So here are several frequent asked questions. So first question, can I add a dependent to my student health insurance plan? Yes, you can add a spouse, domestic partner, or a child as a dependent on your UR-SHIP plan. Does the UR-SHIP plan cover dental service or vision? And the UR-SHIP plan does cover pediatric dental and vision care up to the age of 19. You also have the option to purchase additional dental and all vision coverage by selecting the Aetna Dental PPO Max and all Aetna Vision Preferred plan during open enrollment, as Joyce mentioned before. Can I obtain the immunizations that I am missing at UHS? Sure, UHS can provide all required vaccinations and draw titers to verify immunization history. Can I get other vaccines at UHS? Yes, UHS can provide flu, HPV, COVID-19, and travel vaccines upon request, while the administrative portion of this fee is covered by the mandatory health fee. The vaccine itself will be billed to your insurance as applicable. Please check with your insurance to verify coverage before scheduling your appointment. Can UHS manage my pre-existing health condition? Yes, be sure to include information about your pre-existing health condition on your health history form. You can also schedule an appointment with your primary care doctor to discuss continuing care for your pre-existing condition. Can UHS manage my current prescriptions? Yes, please discuss any medications you are currently taking with your UHS PCP. Several non-prescription and prescription medications prescribed by UHS providers are available for purchase through the dispensaries at UHS office, often at a lower cost than at local pharmacies. If the medication you need is not available for pickup at UHS, you may choose to utilize a local pharmacy, or you have your family ship your medication from home to your CMC box. Students typically choose to pick up prescription at the CVS pharmacy in College Town. The Blue Line and the College Town Express shuttles both can bring students from River Campus to College Town. Can UHS administer my allergy injections? Yes. Students can arrange to receive their allergy injections at any UHS office. There's no charge for the administration of the allergy injection. However, there is a charge for the serum. If your health insurance does not cover the cost of the serum, you will be financially responsible for those charges.
Okay, thanks to my primary care colleagues. I'm going to talk about the counseling center now. We call ourselves the UCC University Counseling Center. I'll be covering who we are, what we offer, and how you can connect with us. So here at the CUCC, our mission is to help you with your emotional health and development while you're a student at U of R. The UCC is staffed by a multidisciplinary team of psychologists, social workers, psychiatric providers, as well as social work and psychology trainees. Well, the health promotion folks are on the first floor. You can find this on the third floor of the University Health Service building, right across from the library. I know we provide in-person as well as remote Zoom appointments. Like primary care, we're open weekdays and also have after hours on call. Every full-time student who pays the health fee can access the UCC, and health insurance is not used for our services here. Every student gets an initial assessment where we'll develop an individualized treatment plan, which I'll talk about later. Their main number is listed here. That's how you can reach us after hours for appointments, for same-day emergency services. That number basically will always get you to us, and appointments are confidential. So if you're over 18, with 18 or over, with rare exceptions, we can't confirm or deny your engagement in therapy with us unless you give us permission to do so. So this slide is what we do at UCC. When you schedule an appointment with us, you're going to get an initial assessment, which is represented by that middle oval there, where you'll share with your therapist what's going on regarding your mental health, and the two of you will develop a plan that may include any of the ovals you see in the outer area, and I'll get into those as we talk more. And all initial assessments we'll start with Zoom. If short-term therapy is kind of the best fit based upon that meeting for your situation, we do provide brief individual therapy here at the UCC. We see students an average of 6 to 8 sessions. We'll meet weekly or bi-weekly. We also have a satellite office in the Eastman Student Living Center, which is where I am right now. This is our satellite office that you can kind of see behind me, but blurred. So if you're an Eastman student and want to do short-term therapy with us, you can meet here right at the SLC. Besides UCC, you also have the option for short-term therapy with a program called TELUS Health, which is a free platform for you of our students to receive short-term therapy in a variety of languages. All students have access to this app. They're free and just takes a few minutes to download. In addition to the short-term counseling, TELUS also offers on-demand text and chat support in a variety of languages, and they also have just a host of self-help resources that you could use as well. Some students, you may find a better fit with long-term counseling, and we have a robust community of long-term therapists here in New York. As Joyce and Yujing mentioned, if you use the SHIP insurance, it's very good. We have a ton of therapists in the area that take that student insurance, and it's generally a $10 copay for those meetings. We can help you get connected in a variety of ways. We use a portal called Thriving Campus, which is an online directory of therapists who want to work with college students to make it easier for you to get connected either here in Rochester or it's general basically across the US. And then Psychology Today and Suicide Stop are two additional resources. Suicide Stop is particularly useful if you're looking for resources internationally outside the country. We have a very robust group therapy program here at UCC, and the connection you get in groups can be talking to peers who you may think may not be kind of going through a similar situation, but you find that they are, can be especially powerful. So we'd encourage you to consider all of our groups. We have several types. There's no limit to attending groups. They generally run per semester, and then sometimes we'll continue over through the year. We have therapy groups, and then there's skills groups, which is more focused basically specifically on developing or practicing specific strategies or skills. And we also have drop-in groups where there's no, I talked about initial assessments before, no initial assessment needed. You can show up, and a lot of our groups are defined by theme or identity-based kind of domains. We encourage all students here, parents too, to know two numbers. One is ours, but also public safety. My public safety colleague will be speaking later. having their number and also our number is particularly important. We have several counselors and residents who are, especially trained graduate students on campus, who may respond to after-hours mental health emergencies. They also have office hours where you can literally drop in and talk without an appointment through the week. We're accessible 24/7 and have a mental health professional on call for any type of crisis or emergency after hour. It's just, again, the same number that was shown earlier. We rotate on-call coverage to cover that number. And then if you can't wait for a initial assessment, we also offer same-day appointments for students where you just can't wait. And in line with our efforts to acknowledge and witness to our students' lived experiences, one of our strongest values, UCC, is social justice, advocating for those with less power and those who experience oppression. We've offered numerous drop-in groups for students in response to a host of issues, racially motivated violence, world crises, and based on student voices, we continue to review and adjust to try to meet students where they're at, and we also liaise with a wide range of student groups to that end and others. Here are a few other services we provide. Within our scope of services, we have psychiatric consultations, we offer case management, substance use assessments, and we, along with colleagues represented here, provide a good amount of consultation and outreach across campus. And we also have a parent liaison, so parents are welcome to consult with UCC staff with us if you have concerns. I just really encourage you to follow us on Instagram. Facebook, you can find basically all the information I mentioned on our website, which is that QR code. Just welcome to U of R. Look forward to connecting with a lot of you. And now I'll turn it to my health promotion colleague, Rebecca Block.
Hi, everyone again. So as folks have mentioned, we're on the 4th floor of UHS in the building right next to the Susan B. Anthony Dorm and Rusheries. And so, yeah, you can call us at 273-5775 if you do want to reach us. But we can also drop our emails in the chat, so you can ask us any questions that way. So the mission of the Health Promotion Office was to lead campus-wide health promotion action to advance a culture of well-being, cultivate student flourishing, and positively influence student health. And so we do that in 4 major things. So our priority actions areas are to create supportive campus environments. So we really think about the places that students are through students living, natural learning, economic, cultural, and social environments that really impact well-being. I also focus on cultivating student flourishing. So providing students with opportunities to learn about social emotional learning and emotional regulation as a foundation to create supportive programming to help students thrive during their 4 years at U of R. We also advocate for health equity, and Zoe will talk about this in a minute of her work. We really pride ourselves in exploring the social determinants of health and promoting supportive initiatives for those most in need. And lastly, we inspire personal well-being. So we create and develop opportunities to build competence and personal capacity so students can reach their full potential. And so how do we create supportive environments? So we have several different ways that we do that. One of which we have our Wellbeing for Life and Learning training. This is a training program that offers a series of workshops for faculty and staff with a goal to create learning environments that cultivate student flourishing. And actually, some of your colleagues on this call are actually involved in that as well. Our Wells Brown Oasis is in collaboration with the Rusheries Library. It's a space in the library that we've revamped that is a place where students can engage in self-care and relaxation. We have de-stress fests in there. We have yoga, mindfulness in there. There's a labyrinth, there's meditation cushions, there's books centered on wellness, and much more in there. And we're hoping to continue those partnerships this year. And so that's what we're doing with creating more yoga and contemplative spaces throughout campus. We're hoping to launch some in the fall or spring semester. And we're also really interested in using our natural environment to engage students in the practices of well-being. And so we do have events where we bring students outside with our certified mindful outdoor guide, and we like to host things outside when we can.
So now I'm going to talk a little bit about how we advocate for health equity among our students. So just so everyone is on the same playing field of what health equity means, we would define it as everyone having a fair and just opportunity to be as healthy as possible. And that would require removing obstacles to health, such as poverty, discrimination, the consequences of those, including powerlessness and lack of access to good jobs with fair pay, quality education, housing, and safe environments and healthcare. So some of the things that we do include initiatives for LGBTQ students. So this includes a resource fair that we do annually, as well as a resource guide that's just available all the time to students online and in person. And then also other sort of one-off events that we do in partnership with our Intercultural Center, which houses the Director for LGBTQ Life. And we also do some stuff for first generation students as well. So we have a new program called the First Generation Wellbeing Ambassadors. And these are members of UHS. Myself and Rebecca are two of them who can help connect first generation students to the resources that we have for you, which we're telling you about today, but helping you to connect to those once you're a student here on campus. And then we offer a number of programs for our BIPOC students, such as mindfulness classes specifically tailored to students who identify as Black, and they're usually led or always led by someone who identifies as Black themselves, as well as partnerships with other offices on campus too. We have a couple initiatives to provide basic needs to students, so to help provide these when students may be in need. So we have a vending machine in the lobby of our building that has all free items in it, which include things like COVID tests, over-the-counter medications, emergency contraception, safer sex supplies, pregnancy tests, and some other just basic necessities sometimes like deodorant and things like that. And then we also have a cart that offers similar products that goes around campus to students to provide things like toothbrushes, toothpaste, deodorant, just basic hygiene products, as well as some fun stuff like fidget toys and stress balls. And I also have worked to make sure that all of our materials that come out of our health promotion office are digitally accessible. So we make sure that students who may have a visual impairment can access all of our materials, as well as some other disabilities too.
So something that we really focus on at U of R is mental well-being. And so we do that in a variety of different ways, but here are the 4 different ways that we do it the most. So our Flourish Festival is our annual spring festival. It's an entire day long festival full of programming and events to help students achieve ever better well-being. And so this includes labyrinth walks, yoga, pet therapy. We have a wellness fair. We can learn about all of these organizations that are talking today, as well as more. We have sound baths. We have mindful eating pop-ups, sometimes food trucks if the weather complies, and more. We also have a monthly pet therapy event called Pause for Stress Relief. This is one of our highly visited programs every month, and students love this. So it's usually held on Monday evenings in our Green Athletic Center, so in our gym, and just allows students to just relax and enjoy some of the trained therapy dogs. We also have De-Stress Fest, and so these are held in the Wells Brown Await Assist. So that room that I mentioned that we collaborated with the library on, and this is an event full of fun and relaxing activities meant to be the perfect study break. And then we also have a workshop called Relax and Unwind, as well as many other workshops centered on mental well-being. And we also have a large initiative called the Mindful University Project. And so we offer a lot of meditation classes, yoga classes, silent meditation retreats, as well as educational workshops for faculty, staff, and students. And so we also offer a student mindfulness facilitator training as well. And then we also really focus on sleep and nourishment and body image. And so we have a variety of different resources. We have a Rise app, which is a free 4-year app that you could use. We also have an online 21-day challenge to improve your sleep hygiene. And we also have other things focused on body awareness and also mindful eating. So we have the Body Project, which is a 4-week evidence-based class to help women develop healthy body image and self-esteem. And we also have mindful eating pop-ups where students can learn about mindful eating and also practice it.
And then we also have a variety of sexual health initiatives. So one of them is called Safe Sex Express. So this allows you to get safer sex supplies delivered for free and anonymously if you wish to your campus mailbox. And then on top of that, there's supplies available around campus in a lot of different areas. So that's not the only way to get them. And then we also have our Ask the Sexpert blog. So this allows students to submit any questions they may have about sexual health. And this is anonymously posted on our website and answered by our experts here at UHS. And then we also offer some free STI testing clinics throughout the semester. So STI testing can always be done at UHS in our primary care area, but these are just clinics that are done by local organizations that do not run through insurance and are completely free for students. And we also have a 21-day online email program called Sex Ed 101, which just sort of has the goal of putting everyone on an even knowledge level when they come into college, because we know that not everybody is getting the same type of sexual education in whatever schooling they were in prior to here. And then there are some ways to get involved with our office if well-being and health is something that interests you or you're interested in what we're talking about today. So we have our Peer Health Advocate team. So this is a team of about 5 undergraduate students who run a lot of our health and well-being programming that we've talked about today. And these students work for about 4 to 6 hours per week, and this is a paid student employment position. So starting in your sophomore year, you could apply to this position, and we would be recruiting at the end of the next academic year for that following fall. And then we also have our UR Student Health Advisory Committee, which is a little bit of less time commitment than the Peer Health Advocate position. So this is a sort of like a student organization that students can meet with monthly, or actually every 3 weeks. And all students are welcome regardless of your class year or anything else. And this just sort of gives you the opportunity to hear from UHS administration and then hear what's going on here, as well as provide us with some feedback about what you think we can be doing better or what we're doing well. And here are just some links to our website and our 2 Instagram accounts. So we have one for our office and one for our Mindful University project that Rebecca talked about. And then before you go, if you'd like to sign up for either of our newsletters, you're welcome to do so now. So here is the health promotion one on the left and our Mindful U one on the right. So those each go out monthly. And now I'll pass it over to Alex from CARE.
Thanks, Zoe and Rebecca. So again, my name is Alex Samores, the director of the CARE Network. I'll give a very, very brief overview of our office before passing along to my colleagues in Title IX and to public safety. So CARE is a non-clinical office, though we do work really closely with all of our colleagues on this call. And we're currently located in the Center for Student Conflict Management within the Office of the Dean of Students. Our office is in the main Wilson Commons Student Activities Building. And we are also open Monday through Friday, 8:30 to 5. I do want to highlight that there are many ways to get in touch with us or to let us know about a concern you have for yourself, a fellow student, or parents and family members if you're worried about your student. One of the best ways is to go to rochester.edu/care and click Submit a Concern. We collect most of our referrals online through that information system. Additionally, you're always welcome to contact us at carenetwork@rochester.edu or calling our phone number highlighted there for any consultation if you're not sure who to get in touch with for your concern. CARE serves the entire student body at the university. We have liaisons who work with our graduate students, and our primary office works with our undergraduate students. We work with students with every question that you could possibly imagine about where to go, where to start, how to use some of these resources. We also provide education and support around that. Primarily, we do see a lot of concerns and referrals related to academics as well as stress and mental health. Perhaps not too surprising, but they often go hand in hand. So we work closely connecting students to resources like the Mindful University Project or our colleagues in counseling, as well as our academic advising office. That being said, we have points of contact throughout the university. If there is any ever question, we are the place to go to find out who to speak with next. As I said before, we can contact care in a myriad ways, and again, we're always open to consultation. If you're not sure what to do or where to go, you can always chat with one of us about what the next step should be. Another question we get frequently is when is a good time to reach out for care? We really try to work proactively. So I usually tell students there's no wrong time to reach out to the Care Network for assistance. Though the earlier the better, the faster we can get a student to the right resource, the less impact a concern or a problem may have on that student, their success and their wellness. So what happens when you submit a referral for one of your students? What happens is we read every single referral. We have a member of our care staff reach out to that student to offer a meeting, as well as a brief overview of many common resources and supports that students have access to. If the student decides to meet with us, it's a very collaborative process. So we really want to hear from the student. What are they experiencing? What's going on for them? And work together to come up with a supportive plan based on their specific situation or need. Again, common concerns really are around mental health and academics, but we also work with students who may have a health concern. Certainly injuries happen, illnesses happen. Getting support around that is significant. Social adjustment issues, it's oftentimes transitory periods, starting off in college, being in a new place for the first time can really very normally bring up feelings of stress or overwhelm. We really do try and highlight that everyone struggles sometimes. We all have questions, and there's always someone to talk to about those questions and concerns. And this is a snapshot of our referral page. So again, you can get in touch with us in myriad ways, as well as I also wanted to highlight also on the Care Network webpage is our Care Resource and Concern Center. This is essentially a search engine that you can use if you're not quite ready to talk to someone in care, as well as to get an overview of many resources and offices across campus. You can type in your concern or your question, and it will automatically populate a tailored list of the right resources and offices related to that topic on campus, as well as how to get in touch with the folks who service that particular area. Thank you so much.
Great, thanks, Alex. Again, going to also move kind of quickly here towards the end of the time. So just briefly for all the incoming students, just so you all know that sexual misconduct is prohibited at the University of Rochester. We have multiple policies that go over the types of prohibited behavior. We kind of, use that umbrella term sexual misconduct to talk about sexual harassment, dating violence, domestic violence, stalking, sexual assault, and sexual exploitation. So we have that basic expectation that folks will know and understand this information as they're coming in as new students, that this is behavior that they are not able to engage in, and that there will be accountability measures if they decide to do that while they're here. Let's click next for me. Again, our office is also similar to Alex, also falls within the Office of Equity and Inclusion. But we have our own kind of small area that's focused on compliance. So that would be the Title IX office, but our office is located in Wallace Hall, Suite 140. That's the Office of Equity and Inclusion suite. It's a wonderful suite. I always recommend folks step in. It's full of treats and goodies and people to always chat with. But our contact information is really easy. It's Title IX at rochester.edu. That is the federal law. IX for Roman numerals, and then our website right there, rochester.edu/sexual misconduct, will get you all the information that you need to get in touch with us, how to report, all the things that I'm going to kind of go through briefly here today. Title IX is a federal law, so we did not create it. We don't have the ability to adjust it. We are kind of the purveyors of the compliance and enforcing that and ensuring that we are following that. It is a federal civil rights law. It prohibits sex discrimination at any educational institution that receives federal funding. So the University of Rochester is not unique. We will not be the only people that have Title IX. Any institution across the United States that receives federal funding should have Title IX. And again, as I mentioned, some of those prohibited behaviors would be verbal or written sexual harassment, sexual assault, stalking, dating, and domestic violence. And we are required to respond and remedy hostile environments. Otherwise, we could be at failure to risk losing federal funding. So as I mentioned, there are several policies at the University of Rochester that students should be aware of. Again, these are all going to come to you during orientation videos, in addition to some online education that you'll get a little bit later in the fall semester once you're a little bit more settled. The reason we have 3 is because we have a federal policy, the Title IX regulations that say certain things have to sound a certain way from the federal government, but we could be more robust at the university. So we also have a conduct policy that is a student conduct policy that applies specifically to sexual misconduct, and that would be our student sexual misconduct policy. So you can see how there are some differences there. The Title IX policy has some significant thresholds that the federal government says that we have to meet. And again, we don't expect that our students are going to understand these. That's why we are the purveyors of this information. That's why we offer opportunities for students to meet with us, to learn about those reporting rights directly, and to talk about if any of those behaviors fall under prohibited behavior, what policy might it fall under. Our office also oversees the university policy against discrimination and harassment. And this applies to folks, mostly faculty and staff, but it can apply to students if there's any discrimination on the basis of protected class. And as you can see, that list there is quite extensive. Here in New York State, we have a lot of protected classes that we would, follow up with if somebody submits a report to our office. Our team really comprises a lot of folks. We have a Title IX coordinator, but we also have designated deputy Title IX coordinators who help us with the work that we do. And they are in each of the schools at the university. We have graduate schools. We also have one for athletics specifically. Their role is really, again, to be the person that you go to complain about sexual based harassment and misconduct. They'll help you understand legal rights and make sure that those are handled promptly and equitably. And again, that's their main role. We don't actually investigate or adjudicate claims. We have investigators that we will work with. Those are equal opportunity and Title IX investigators. Those folks are well trained. They conduct neutral and impartial investigations. They are basically fact finders for our office, and then they will compile a civil rights complaint investigation. So that is if you go that route. Where I kind of land is the prevention and education staff, as I mentioned, also here to help envision and design and implement evidence-based programming around the topics of sexual misconduct prevention awareness, Title IX compliance, and again, issuing those to undergraduate and graduate students throughout the year. I also work with faculty and staff, but again, we're really focused on creating a consent culture and talking about being badass bystanders and engaging our students in those ways. And we also are lucky enough to have student employees in our office who help go out and talk with their peers, do events throughout the year to make content more digestible in addition to the other work we do. And then our last little blurb is administrative staff, obviously, because we would be nothing without the help of those folks keeping us organized. You could click through this real quick for me, friend. Thank you. Again, really, if you want to get in touch with us, obviously, if you want to bring up a concern or file a formal complaint, if you want to learn more about your reporting rights or available actions through our policies, get resources. We have a ton of them. Always can ask questions. And then, of course, if you want to get involved in training or proactive educational programming, I get requests throughout the year based on groups, all sorts of incoming students, and we will work to tailor some of that content to really just make training as digestible as possible for all of our students. You can go quickly. This is kind of really once you get into the thick of it. If you do actually meet with us, you have rights. This is an optional meeting. We don't require folks to come meet with us unless there's something that you're being alleged of doing. But really, this is very fluid. We're here to try to help folks after something may have happened to them that might be detrimentally affecting or impacting their education. So again, this is information that really will be important for incoming students to observe when you go through your webinar and your Blackboard information. And this information is available all on our website. So that way I can give our friends from public safety some time to discuss their area as well. And like I said, please get involved with us. We do stuff throughout the year. When students get here, you'll see that there's some events in October, there's events in April. We do some programming throughout the other months as incoming students are coming here. And so again, really the best type of prevention work is getting people involved. We need everybody to prevent and stop this stuff from happening. So I hope that more folks will get involved when they can. Yeah, you can click it. Next one's fine. Again, there's our contact information as well. Like I mentioned, our email and our website. We also have social media that we're pretty robust on. We post pretty often, especially for April. Feel free to scan that QR code. And I appreciate everybody for taking the time to listen to us. And I'll hand it over to Josh.
Thanks, Steve. Again, everyone, my name is Josh McCartan with the Department of Public Safety, or DPS, as we're referred to. I'm just going to give a brief overview of our department and then gladly answer any questions at the end here. Just real quick, an overview of our mission. Obviously, we're here to protect the people at the university, and secondly, to that, inform our community about any security issues or personal safety measures that we can bring to light to prevent crimes from occurring on our campuses. In addition to that, fostering beneficial community relations is a priority for us right now. We are out there in the community offering education and interacting on how we can do better as a law enforcement entity. Our department consists of about 160 officers or members. Of that 160, a little over 111 are sworn law enforcement officers. The remaining numbers are support personnel, such as our non-sworn security staff. We do have dispatchers on staff, and then civilian support administrators who, like T said, keep us organized behind the scenes. Our community that we serve consists of approximately 43,000 people, so it's a fairly large demographic. Our communication center takes about 250,000 calls per year. Of those calls, 76,000 result in a physical response by a DPS officer. As you can see towards the bottom of the slide, it breaks down to about 208 responses a day, so on and so on. We tend to stay busy. Of these numbers, I don't want there to be concern. Those are not all crimes in progress. The majority of our workload is service oriented and supporting our faculty, staff, and students here at the university. Our deployment, obviously the River Campus and Eastman Campus, the two college focused entities. In addition to that, we are heavily staffed at U of R Medical Center, which is across the street from the River Campus. We're also at the Memorial Art Gallery, Strong West, which is a medical facility in Brockport, New York, and then the Brighton Health Center. On duty at one time, we have about 22 to 30 officers on staff at one time. And in addition to that, they're supervised by up to 5 different ranks of supervisors at one time. Our department's divided up into various sections. Of this list, the most important and the one that you'll interface with mostly is our uniform patrol section. As you can see in the picture to the right, it's a generic uniform that we wear that would identify us as any other law enforcement entity that you're familiar with in your hometown community. These are the officers that will be responding to the request for service on the front line. All the kind of facets below are a supplement to patrol. So like for instance, our training unit is responsible for the training and overall success of our officers. Investigations is handling criminal investigations, victims assistance, and so on. Our officers are New York State peace officers. They're not considered police officers. The difference between the two is that a peace officer can only exercise their law enforcement authority while they're on duty and in a predefined jurisdictional boundary. Whereas a police officer, they're considered on duty all the time and can enforce their authority anywhere they're located. Our authority consists of enforcing New York State penal law, the criminal procedure law, vehicle and traffic law, and mental health law. We're able to make arrests, conduct mental health detention, serve orders of protection. All the traditional law enforcement services that you're familiar with in your community, we can provide you here right at the university. Our jurisdiction falls on any university-owned property, in addition to any street or sidewalk that adjoins that property. So we are limited to anything that's owned by the university, and then any street or sidewalk that touches university property. In addition to that, we do have partnerships or what we call memorandums of understanding with the local police departments that we cross jurisdictions with. Depending on the call for service, DPS will be more than likely the primary responder. But if it's more resource intensive, we may be requesting one of these departments listed below to help us out. Our training, New York State peace officers or our peace officers, they go to a police academy, a traditional police academy. It consists of about 600 hours of classroom training at the police academy. In addition to that, once they leave the academy setting, they come out and do an additional 520 hours of field training with a senior officer. During this process, our standards are extremely high and the officers are constantly being evaluated. With that being said, if you do not meet or exceed our standards, you probably won't continue employment here. How can we help? This is just surface level services, but obviously we can enforce the laws and university regulations. We're going to provide a visible presence on campus in an effort to support safety and deter crime. We can document, investigate crimes, motor vehicle accidents, or other university-specific incidents. Obviously, not every incident that occurs on university property is a crime, so there's other things that we may be involved with or assisting another facet of the university with. We're able to provide resources and support to victims of crimes, obviously in partnership with the other entities that are here today. And then when the need arises, we will also develop specific safety plans for individuals to help promote their safety after being involved in that specific incident. We will provide safety or escorts when requested. So for instance, if it's late at night and the student doesn't feel safe walking back to their dorms, they can call public safety and request a safety escort. We are an intermediate service for crisis intervention here on campus. So essentially we would be the first responders to for instance, a mental health crisis. And then to supplement our initial response, our partners at UCC, the crisis or the counselor and residence program, et cetera, would come and help us navigate that incident. Moving on, we respond to all medical emergencies. We're able to render first aid until an ambulance arrives. We do manage Allen property here at the university that is university-wide and a huge undertaking. So if you lose property, contact DPS. More than likely it's been turned into us, and if it's not, we can surely help you try to locate it. In addition, we provide specialized education and support to campus. Obviously, community education and outreach is a priority for us, as I mentioned earlier. If you locked out of your car or your battery's dead on campus, we can assist you with that. Or if you're locked out of your dorm or your office, we can also come and open that for you. And we manage all university issued ID cards and access control. So if you lose your university ID or are having issues with it, DPS is the place to go for that. And there is a lot more that I don't have time to mention today. What happens when you call us? This is a question we get a lot. So just a brief overview of the kind of the workflow, but essentially someone will call DPS and speak to a public safety dispatcher. This person is not an officer. First and foremost, they're an information gathering person who is then going to communicate that to an officer who's going to respond to the location. They're going to ask a lot of questions, so please be patient with them. Just know the questions they're asking are to promote safety, especially if it's an in progress crime or an incident. The officers need to know and want to know what they're walking into, and the only person that can really provide that initially is the initial caller. Secondly, obviously, like I mentioned, we're going to be dispatched promptly. Our response times are very short. I would say under a minute in most circumstances. With that being said, if you are the initial caller, you're going to be asked to stay on the phone until that first officer arrives on scene. Once the officer gets there for in-progress situations, de-escalation is key. So the officer is going to address the situation, begin to de-escalate, all in an effort to promote safety. Number 4, any actions or services will be provided by the responding officers based on the incident. Obviously, multitude of incidents, multitude of actions or outcomes that are required. That's just too intensive to kind of go into detail on that. But essentially, the officers are going to do their part to make sure everyone's taken care of on scene. And then lastly, the officers are going to document the job as they do for a majority of the calls that they respond to and perform any follow-up actions if necessary. This slide here is how to contact us. This is a very important slide. If you're not issued your university ID, or once you are issued it, on the back side of the ID in the red box is all of public safety's contact information. In addition, you can call or text us at this 585-275-3333 number. That's 24 hours a day. You can dial 13 from any university phone or #13 from any cell phone. And then the blue lights scattered around campus, you just pick up the handset and it's a direct dial to public safety. This last slide here is just some resources. We do post a lot on our social media accounts, some crime prevention type related information. And if you scan this QR code, it'll add public safety's phone number and address directly into your cell phone. Thank you.
All right, I think that's all of our time, but I think we could if there's any questions, we could probably take some time to answer those. But here is all of our contact information on here for UHS. So if you want to take a picture of this, you're welcome to do so.
I'd like to take a quick moment to just thank you. Thanks so much to our panelists for being here. Those folks that are really just putting the students first here on campus and making sure that everyone is safe and cared for and that everyone's well-being is respected. So thank you so much. We are out of time. It looks like all the questions have been cleared as well. So thank you very much for asking questions during this session. And we want to again just say thank you. Congratulations again on being admitted to Rochester. If you have any follow-up questions, do reach out to any of the folks that you saw here today, and we'll be happy to help you out. But have a wonderful evening if you're here in upstate New York or wherever you are. Have a wonderful day ahead, and we'll see you hopefully this fall. Thank you so much.